How to understand prescription help eligibility. Imagine trying to get your medications at a price that fits your budget, but feeling unsure about whether you qualify for assistance. That's a common concern for many seniors. Today, we're going to break down how you can figure out if you're eligible for prescription help programs and what steps to take. First, to qualify for Medicare prescription drug coverage, known as Medicare Part D, you need to have Medicare Part A, which covers hospital stays, or Part B, which covers doctor visits. You must also live in the service area of the plan you want to join. If you have a Medicare Advantage plan that includes drug coverage, you cannot enroll in a separate Part D plan. Usually, you become eligible for Medicare at age 65, but some qualify earlier due to disabilities, end-stage renal disease, or amyotrophic lateral sclerosis. Enrollment is key. You can sign up during your initial enrollment period, which starts 3 months before you turn 65 and lasts for 7 months. There is also an open enrollment period from November 15th to December 31st each year, where you can switch or join plans. Special enrollment periods may apply if you move or experience other qualifying life events. Now, let's talk about the Extra Help Program, also called the Low-Income Subsidy. This program helps people with limited income and resources pay for their prescription drugs. To qualify, your income and assets must be below certain limits, which are updated yearly. For example, in 2023, the income limit for a single person was around $15,000 a year, and resources like savings or property must be under $9,000. If you already get Medicaid or supplemental security income, you automatically qualify. Otherwise, you can apply through the Social Security Administration or your state Medicaid office by providing proof of income and assets. If you qualify for extra help, your out-of-pocket costs for prescriptions are greatly reduced. You pay less for premiums, deductibles, and copayments. Some people pay as little as a few dollars per prescription, and there's no late enrollment penalty if you qualify for this program. Understanding costs is also important. Medicare Part D plans have a deductible, which is the amount you pay out of pocket before coverage kicks in. After that, you pay coinsurance or copayments, which are your share of the drug costs. Once you reach a certain spending limit each year, you enter the catastrophic coverage phase, where your costs drop to just a small percentage. If you qualify for extra help, many of these costs are reduced or eliminated, making medications more affordable. To get started, review your Medicare coverage to confirm you have Part A or Part B. Check if you live in the service area of the plan you want. Determine if your income and resources qualify you for extra help, or if you receive Medicaid or supplemental security income. Enroll during the correct period to avoid penalties. Compare different Medicare Part D plans to find one that covers your prescriptions and fits your budget. And finally, apply for extra help if you think you qualify, either through the Social Security Administration or your state Medicaid office. In short, understanding your prescription help eligibility involves knowing your Medicare coverage, your residence in a plan's service area, and your financial situation. This knowledge helps you access affordable medications and manage healthcare costs more effectively.